Welcome to the Smart Delegation module. In this module, we'll discuss some recommendations that you can use to guide your own decision-making process when you're considering delegating tasks to a PTA. You might also find this helpful to use as an outline for helping your DPT students learn and practice valuable delegation skills. Following the simple guidelines in this module can help you ensure that your delegation is appropriate and safe. Your State Practice Act likely addresses appropriate delegation to the PTA. For example, as you can see from this statement in the Practice Act for the state of Utah, the PT is responsible for deciding which interventions can be safely delegated to the PTA based on scope of practice, efficiency, and effectiveness. Your Practice Act might also define which tasks are or are not within the PTA scope of practice, but we'll talk about that in a minute. Fortunately, we don't have to figure this all out on our own. We can refer to our local Practice Act for legal requirements, and we can refer to professional standards on delegation published by the APTA's House of Delegates. The documents that you see listed on the screen will be our main sources for this information. So the documents in the previous slide describe several factors that we can and should consider as we decide whether a given task is appropriate for delegation to the PTA. As you can see from this list, these factors range from individual characteristics of the patient and the PTA to external factors such as laws and reimbursement. Now, we'll take a brief look at each of these factors separately. The first question we should probably ask is whether or not the task is within the PTA's scope of practice, both professionally and personally. So on the professional level, does the intervention fall within the general scope of practice for PTAs as defined by the Profession and the State Practice Act? If so, then we can ask the second part of the question, namely, whether the individual PTA's training and experience are adequate for the task. If we can't answer that part of the question, then we might need to spend a little time finding out more about that PTA's training, what they feel comfortable treating and what they don't. We should probably discuss it with the PTA to get their perspective, and then we can also observe the PTA during treatment to help us get a better feel for their skill set. This small effort can pay huge dividends by helping us delegate confidently and efficiently to the PTAs with whom we work. Another consideration is the patient's characteristics. Remember that the PTA's scope of practice does not include clinical decision making. So if the patient's presentation suggests that decisions will be required on a regular basis, their care should probably not be delegated to the PTA. For example, is the patient's list of comorbidities so complex that clinical decision making will be required on a regular basis? Or is the patient so acute or so unstable that interventions will require continuous decision making? If so, this patient's care would be beyond the PTA's scope. To some extent, this might depend on the individual PTA and their personal skill set, but if you expect the patient's condition to require frequent changes to the plan of care, you should probably retain their care for yourself. Somewhat related to patient complexity is the predictability of the patient's response to treatment. Is their response so unpredictable that you expect to be making clinical decisions on a frequent basis? If so, delegation may not be the best choice. Federal and state laws should also be considered. If there are laws or professional standards that differ from one another, it's usually recommended to follow the one that's most restrictive. Let's look at an example of this. In the Utah State Physical Therapy Practice Act, PTAs are allowed to perform joint mobilizations only if they are simple distraction techniques or if they can be taught as part of a home exercise program. However, the APTA's position is that joint mobilizations are the sole responsibility of the PT. So if these differing guidelines, would you delegate simple distraction mobilizations to a PTA? You could have good rationale for either decision, so just make sure that you've considered all the factors discussed here before you delegate this task in the state of Utah. And on a side note, the Practice Act in Utah also stipulates the frequency of supervised visits and the number of supportive personnel that we as PTs are allowed to supervise at any given time. If the PTA is providing care, we need to see the patient every 10th visit or every 30 days, whichever comes first. And let's not forget payer requirements. Two prime examples are Medicare and TRICARE. As of this writing, TRICARE doesn't reimburse for PTA-provided care, so while it may be perfectly legal to delegate an intervention, you might not get reimbursed for it. Medicare also has its own specific guidelines for PTA supervision and delegation that have to be followed in order to get reimbursed. For example, in private practice outpatient clinics, the PT has to provide direct supervision to the PTA, but in a hospital-based outpatient clinic, general supervision is allowed. So it's wise to keep abreast of these requirements to ensure that you get reimbursed appropriately. Finally, we need to consider any potential liability or risk management concerns that could affect our decision to delegate. Would having the PTA perform a particular treatment put them, you, or the patient at risk physically, financially, or otherwise? This might have as much to do with personality and other individual characteristics of the PTA and the patient as it does with external factors like laws and payer requirements. If your answer to any of these questions is yes, or even maybe, you might want to protect everyone involved by treating the patient yourself. All of the factors that we've discussed in this module are graphically summarized in the APTA document titled PTA Direction Algorithm, pictured on your screen. If you're an APTA member, you can access this document at the URL listed here. If you're not an APTA member, you can still find a summary of these factors listed in the House of Delegates document titled Direction and Supervision of the PTA from the second URL listed here. If you ever want a quick reference to the principles we've discussed in this module, these documents are a great source of information. So, our take-home message from this module is that appropriate delegation can be efficient and safe when we form the mental habit of quickly considering these critical factors. Once you're in the habit of mentally addressing each of the factors, you'll be able to delegate confidently and make your practice even more effective. Also, keep in mind that no other supportive personnel, such as aides or ATCs, are as trained and qualified as the PTA to provide physical therapy interventions. So don't be afraid to delegate patient care to them. Just make sure that you're doing it from an informed perspective. Thanks for listening.